Mr. ABC, based on my physical exam and the history you have provided with me today, my suspected diagnosis for you is peripheral arterial disease, which I will refer to as PAD. PAD is a disease of your arteries, specifically in your limbs, especially in your lower extremities. It typically affects those ages 60 years or older. PAD is when the blood flow to your limbs, in your case, in your legs, is reduced. The cause of the reduced blood flow is plaque buildup, also known as atherosclerosis. Because the blood cannot flow properly to your legs, as a result, your legs are not receiving the proper nutrients and oxygenation that they need. As a result of this, you may feel pain with ambulation, which is something you have discussed with me today. This pain with ambulation is called intermittent claudication. I have this picture here that is a visual aid to what I have just described. On the left, you'll see a normal artery with normal blood flow. As you can tell, there is nothing blocking the artery, therefore nothing blocking the blood flow. On the right, you'll see an atherosclerotic artery. The yellow is plaque buildup, which blocks blood flow, which then decreases oxygenation and nutrients, which can cause pain in that extremity when ambulating. I will confirm my diagnosis by performing 3 tests. The first test I will perform is an ultrasound of your legs. This ultrasound is a Doppler measurement of blood flow, which means it will tell me if the blood is flowing inadequately in your legs, which would indicate PAD. The ultrasound is non-invasive and poses no risks to you. Additionally, I will check your ankle brachial index, another non-invasive way to diagnose PAD. For this, I will check the blood pressure in your arm and the blood pressure in your ankle. A low ankle brachial index number can indicate a narrowing or blockage of the arteries in your legs, which would also indicate PAD. The third test I will do will be to listen with my stethoscope to your arteries in your legs. I will be listening for bruit, which is the sound of blood moving through a narrowed artery. This would also be indicative of PAD. Mr. ABC, one way that you can participate in your care is by quitting smoking. Quitting smoking can help decrease the plaque buildup in your arteries. Another way you can participate in your care is by monitoring your diet intake and increasing your exercise, as you do have hypertension or high blood pressure. Hypertension is a risk factor for developing this disease. By choosing foods lower in sodium and lower in saturated fats and increasing your physical activity, you can help lower your blood pressure. Additionally, make sure to keep taking your blood pressure medications as ordered and taking your blood pressure at home as ordered. I will also prescribe you medication to help prevent any blood clots from forming and also a medication to help lower your cholesterol. Do you have any questions for me today? No? At this time, I will assist you in making your next appointments here so we can stay on top of your diagnosis and your care. Please do call the office at any time if you have any questions.